All right, let's bring on our next guest. And she's got quite an interesting story about what they're doing AI to help uh, people with their mental health problems. April Coe, CEO, Spring Health, springhealth.com. April, welcome to the show.
Hi, thanks for having me.
All right,
How are you?
I'm good. Thanks for being here. All right, tell me about your background, and let's get into Spring Health.
Yeah, sure. So I'm CEO and founder of Spring Health, and as you mentioned, we use AI to help people with mental illnesses get better faster.
Hmm.
And I started Spring with my co-founders while we were still in school, actually, at Yale University. I had taken a few years off of school to build tech products at startups in LA and Silicon Valley. And when I went back to school for my senior year, I knew that I wanted to use my product and tech experience to leave a positive impact on the world. And I was especially passionate about mental health. It was an issue that was super important to me. A lot of my close friends and family have been affected by mental health issues. And one of my best friends in college actually struggled with severe depression for several years. And I watched her through her process of recovery. And it was excruciatingly painful and long. It took multiple mental health professionals, multiple mental health professionals. It took multiple treatments, and actually, she took 7 antidepressants to find a regimen that worked for her. And so, her experience got me thinking: what if what if there were a mental health solution that made mental health care so convenient, so efficient? And what if that solution got the right treatment right from the very beginning, right? And it just got me thinking. And so because I knew I wanted to do something in mental health, I had a habit of reading papers coming out of Yale's psychiatry research labs. And I found one paper that was published in one of the leading psychiatry journals, Lancet Psychiatry, and was authored by my now co-founder and chief scientist of Spring, Adam. And he had written a paper describing an AI model, so a machine learning model, that outperformed psychiatrists significantly, actually by 2 times, in determining which treatment would be most effective for any given person, right? And I just read that paper, and it clicked for me. I knew this was the approach that I wanted to apply to mental health. I knew that I wanted to use machine learning and the power of the latest technology to improving mental health. And so I reached out to Adam. We talked about the paper. We became friends. I kind of looped in one of my good friends from the computer science department. We created a prototype really quickly. All of us know how to code, so we just created a prototype. It was essentially a questionnaire online that would collect information, and then from that information, from the data, be able to predict what treatments would be most effective for someone. And so we created this online questionnaire. And we went out and did a bunch of pitch competitions, right? We applied for a bunch of grants. We did pitch competitions. We did, business plan competitions, and we got about 100K in non-dilutive capital to start with. And we just won all of these awards. And what we were realizing was, as we were pressure testing this idea of using machine learning to improve healthcare was really resonating with people. And so that happened about 1.5 years ago. Since then, we've raised $2 million more in seed capital, and we're working out of Brooklyn, New York. Yeah, so that's a little bit of my background.
How does it work? I mean, is there some type of a response that goes into the therapist's head that says, "Here's what you should try next," or is it something that the patient uses with a touch screen?
Yeah,
how does it work?
yeah, So I'll answer your question. Let me give some background first. So it turns out that trial and error in mental health care is a huge problem. A lot of people experience trial and error. So 70% of patients don't get better from their first treatment. And this is even with the best doctors out there, right? Even the best doctors just don't have the tools or any way of knowing what treatment would work for any given individual. And so what usually happens is you'll go to your psychiatrist or maybe your internist, and you'll say, "Oh, I feel down, I'm depressed." and they'll just say, okay, let's start with Lexapro, and then you'll try Lexapro for a few weeks, and then you'll go back, and then they'll say, oh, okay, then let's try Prozac, right? It's a little bit more methodical than that, but it basically is that, right? It's just guessing game until you find something that works for you. And so this process is incredibly inefficient, right? And so what we do instead, right, is we collect data from you online. So we ask you a series of questions. If you go on springhealth.com, you can take this test, and from these questions, we're able to identify what conditions you might be experiencing. So it might be depression, it might be anxiety, you might have some bipolar. And then after identifying kind of what condition you might have, we then match you to the treatment that would be most effective for you, right? And so we present that in a results page. And then we don't just tell you what will work for you. We then connect you to a mental health professional, one of our own mental health professionals. So these are licensed therapists. These are certified doctors, right? Who are connected to you, and they deliver the care to you. So, and they deliver that care virtually, right? So you meet with a therapist or your doctor online via video. They diagnose you. It's just like a regular visit, but just online. And they're able to prescribe one of our treatment recommendations.
April, we've got to close, but I want to thank you for being a great guest, and contact for you is springhealth.com. Is that right?
Yep.
All right, time flies. All right, April Koh, CEO, springhealth.com. Thank you for listening to CEO Money. I'm Michael Yorba, your host. This segment brought to you by Tycon Partners. Tune in again tomorrow for more great content. If you have somebody special you want us to put on the show, reach out to us. info@wfn1.com. Thanks for listening. We'll talk to you again very soon.